Up today as well. Moderna says it's planning to ask both the U.S. and Europe for emergency use of their vaccine. Moderna says their vaccine is more than 94% effective. The company behind Pfizer and BioNTech says it wants to start vaccinations in the U.S. in December. So on that note, let's start with Dr. Dishman with Stormont and Vail. It's easy to say that people are looking forward to a vaccine. And Marianne Whitman from Topeka wants to know, when someone has received the vaccine, are they protected enough to enter society without a mask or social distancing? Will the vaccine provide a kind of armor for an individual, or will protection not be available until we achieve herd immunity?
Well, Kelly, we really look to the vaccine as something that's going to bring this pandemic to a close. What we know about the vaccine is that we're seeing anywhere from 95 to 96% effectivity of the vaccine, and that will provide a significant degree of immunity to those individuals that receive the vaccine. How long that immunity lasts, we do not know at this time. And so still, even after the vaccine is available, we'll need to follow social distancing, continue to wear masks until we learn more about what the vaccine can do.
And Dr. Dishman, what are we learning about how long someone is immune to coronavirus after they've received it?
So what we know right now is that you are immune for a significant period of time afterwards. Specifically knowing exactly how long that is, we don't know at this time. We also don't know that when someone has the coronavirus, how long their immune system will continue to defend against the virus and how long that period will last.
Now, Gwen Puthuff wants to know, if you were vaccinated but you were previously exposed, can you still spread the virus?
The key to the treatment of COVID-19 is, of course, to ensure that the appropriate treatment is received at the time that the virus is contracted. After that period, after the quarantine period, after 10 days, the amount of virus that someone is spreading significantly decreases to the point where, with the appropriate precautions, they are less infective to those around us. That's really the key to wearing your mask, making sure you remain socially distant, and not being in large groups. Even with the vaccine, we'll still need to continue those things and continue to be diligent in our efforts.
Definitely an important reminder. Now, Ms. Puthuff also wants to know if healthcare workers will be among the first to be vaccinated. And if so, what happens to the spouses of those healthcare workers? Can the healthcare workers still carry the virus and spread it home to their spouse even if they are vaccinated?
In terms of the vaccine, everything is being worked out at this time in terms of availability, in terms of who's going to receive the vaccine first, and what the ramifications are for their close contacts. More to come on that, and that's all being developed at this time.
Now, another vaccine-related question from a viewer, Vernon Peterson, wants to know, where will the vaccine be available? It's clearly a popular question because Tom Harrington also wants to know who will administer it. Do we think that we'll see it at the hospitals, health departments, or our pharmacies?
Again, that's to be determined. Our state and local governments are working on that, along with the federal government at this time, to figure out first how to distribute the vaccine, how to determine where that's going to be administered, and who's going to be administering that. So we're still waiting at this time for all of those details to be worked out.
Now, while those details are worked out, are there any concerns about the long-term impacts of getting a shot once it's available, or is this something we'll just start to figure out once it happens, kind of like we have with the virus itself?
We know that both companies, Pfizer and Moderna, have done a diligent job of trying to ensure that this vaccine is as safe as possible. There are side effects that occur with other vaccines that we take, such as the vaccine we take every year for influenza. These, at this time, we think that there will be minor changes that could possibly occur when the vaccine is received. We'll continue to learn more about that as our experience develops.
Now, in our earlier newscast, we talked about when these shots will be delivered or when they'll be starting to vaccinate people, but do we have any timeline on when they'll reach Shawnee County and what that shipment could look like?
We really don't know when, at this point, that those vaccines will reach Shawnee County. there are estimates that we may be able to begin vaccinations on the highest risk groups as early as later on in December. At this time, Kelly, that's all we have is some suggestions that it may be that early. No final details yet.
Dr. Dishman, is there anything you'd like to tell people at home about the shot from your perspective as a doctor?
At this time, I would encourage everyone to ensure that you maintain your social distance, wear your mask, and obtain the vaccine when it is available.
Thank you, Dr. Dishman. Now, we're going to take a short break here, but don't go anywhere because our coronavirus conversation does continue. We'll check in with Nick Xidus to talk about COVID and business impacts right after this.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vail Health, empowering you together.
Your news every hour in primetime is on News Nation on WGN America. News Nation reported on challenges to rural health care.
And there's a tremendous need.
And News Nation investigated the murder of a 15-year-old boy whose family said authorities did not take seriously.
They didn't do what they could have done to save his life.
News Nation covers your nation every night starting at 8, 7 Central on WGN America. Go to newsnationnow.com to find WGN America on your cable or satellite provider.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vail Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.
So that rash or spot you said I should keep an eye on, it's definitely getting worse.
Okay, let's take a look.
Ew.
There's definitely some swelling. Is it warm to the touch?
Yeah, it's pretty warm.
Okay, well let's try a prescription ointment. Is that a Justin Bieber tattoo?
Okay, gotta go bye.
Stormont Vail now offers virtual care, so you can talk to your doctor almost anywhere. Download the MyChart app to get started today.
Welcome back to our coronavirus discussion. Now for our next segment, I'm joined by Nick Xidus, who owns Hazel Hill Chocolate in downtown Topeka. Thanks for being here with us, Nick. Now you're also with the local Economic Recovery Task Force. So what does the business landscape look like right now here in our area with the pandemic?
Boy, it's challenging. And it's challenging really in a couple of different ways. The obvious one is the restrictions on business that prevent us from doing everything that we might like to do. The ones maybe you haven't thought about is, as you see those numbers of people who are sick or who have to quarantine because somebody close to them is sick, that knocks people out of the workforce. And for a lot of businesses like ours, work from home is really just not an option. So those have an impact, and we have to adjust around those. Kind of the third area that you might not have thought of is those same type of people and restriction problems affect our suppliers. So where we might be able to get certain raw materials and ingredients on a pretty easy basis during normal times, we have seen limits and restrictions around the things that we need in order to produce products.
Yeah, that's definitely tough. Now, as a small business owner, you felt the impacts firsthand. Can you talk about maybe some of the nice things that our community has done and that they're still doing to keep businesses like yours afloat, and maybe how else they can help?
Look, I can't say enough about how well we have been treated in Topeka and Shawnee County. And look, it runs the range from our pal Cody Foster putting out some incentives to get people to shop small on Small Business Saturday, and the GTP partnership supporting that. Look, less well known are the armies of people who have done the small things. Early in the spring, we had people bringing us masks. We had people coming in and buying $100 gift cards. Look, we knew they didn't need, but they were just there to make sure that we would be around and to try and take care of us. It's one of the best parts about where we live in Topeka and Shawnee County, that people really do care and are out there to help.
That is just wonderful to hear. Now, many businesses are having to shut down for a few days entirely when someone on their staff tests positive. And to the outside, it seems like just a day or two. But what do those couple of days do to a business?
Look, that's a very personal question, because we shut down for almost 5 days, and it was because my wife and I both contracted the COVID virus. So we stopped our business operations in order to allow time for folks to get tested and for us to make sure that we weren't spreading the virus among ourselves and we weren't putting people at undue risk who might be visiting our business. So look, those things are going to continue to happen. And whether it's that they're short on staff or that they've actually got an outbreak because somebody on their staff got sick, you should be happy that those businesses are taking those things very seriously. And when they reopen, look, you got to get in there and you got to patronize those folks who are taking this very seriously and acting responsibly. Don't be overly afraid when somebody shuts down and manages this in an effective way.
Now, you said you contracted coronavirus yourself, and, I see you in your business all the time. You're there every day, working hard, and I see you turning out that chocolate. So was there ever a moment that you were worried that the business might not come back after you and your wife were affected? Were there ever any moments like that?
Look, no, our business probably not. Look, we have been here a long time, and we're in a very stable situation. That's not true for every small business, especially ones that are newer. If you can imagine, they're not only trying to live on, say, half their income if they're a restaurant, but they've also got their construction loans and their initial capital loans that they're trying to service as well. So, look, I can't overstate the importance. You got to get out and you got to patronize those restaurants and those shops, or they're not going to be around next year. It's just that simple.
Yeah, that's a very important reminder. Now, we do have a viewer question here for you. Marla Bowman wants to know the impact the virus is having on businesses when employees are required to stay home for 10 days if they are exposed to the virus. Are businesses able to pay these people to be off, and is there any relief for employers like you in this kind of situation?
So yes, there is. And yes, look, as part of the CARES Act, we are required to pay those folks who are home either because they're sick or because they have to quarantine for 2 weeks. And we do get some payroll tax credit back on that, so there is a little bit of help on both ends. But look, it's not a free ride. You don't take somebody who has 10 years of experience in a particular skill, drop them out because of the virus, and expect to replace them with somebody new. So it's a challenging time. And look, I expect as we roll into Christmas and we see potentially the virus cases spike because of the Thanksgiving holiday, that those people challenges that she's asking about are going to continue to be a source of challenge for small business. And look, if you can, be patient. Look, things are going to go wrong. And those small businesses like us are going to do everything we can to make sure that we honor commitments and we provide the things you need. But you also got to be kind and have a little grace for those who are trying to make this work.
Do you feel like small businesses are hurting more now than ever, more than big box stores like, say, Walmart or Target?
Yeah. Look, Walmart and Target are going to post record sales thanks to the pandemic. Small businesses are on the exact opposite end of the spectrum. Look, we got some great assistance from the payroll protection loans and from Spark program and some other things, but that's behind us. And especially for retailers who the bulk of their business is going to happen in November and December, if that doesn't happen for them, come first quarter, they're potentially going to be in very serious financial straits. So I can't overemphasize the small restaurants, the community shops. This is the time that they need your support. Hopefully there will be some additional state and federal support, but right now that's not there. So it's really up to us who care about those businesses in our community.
Now, you did say that some of the relief is behind us and we might see more, but you are on the local recovery task force and the Small Business Council. So what are those groups doing right now to help businesses that people should know about?
Look, there is still funding available for the Spark program. Shawnee County also has a program for businesses who develop a business continuity program. They can receive a grant of up to $5,000. So there are continuing programs that are available in small amounts of money. That doesn't even begin to touch the kind of funding that the payroll protection program provided. Look, those were 5- and 6-figure infusions of cash into businesses who are struggling. There's nothing of that magnitude currently available.
Now, I understand you have a way that you'd like to help give back. Can you tell the viewers at home a little bit about that?
Yeah, if you give me a minute on that. Yeah. We have been the beneficiaries of some very kind and generous folks, and we want to pay that back. And I'm especially concerned about the restaurants who are suffering. And so, look, starting tomorrow, you bring us a receipt, a ticket from any of the Kansas Avenue area restaurants. Bring that to us or bring it to us online. We're going to knock $5 off your ticket at our shop. So, look, I don't care if you go in or if you do a pickup or something like that, but those restaurants especially need your help. And look, you bring that ticket to us, we'll kick $5 off of whatever you'd like out of our shop.
What a wonderful idea, Nick. Now, we're going to take another short break here, but don't go anywhere because our coronavirus conversation still continues, and we'll check back in with our expert from Stormont Vail on many more of your submitted questions. Stay with us.
We Together, a coronavirus discussion sponsored by Stormont Vail Health.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vail Health, empowering you together.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vail Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.
Did you hear that?
It sounds like
the most merry musical event of the year. First, your favorite holiday songs performed by the biggest stars with a touch of Disney magic. The Disney Holiday Sing-Along.
Welcome to our CMA Country Christmas home.
Then, join host Thomas Rhett, Lauren Akins, and your favorite stars for country's most festive night. CMA Country Christmas. It's the most wonderful time of the year. Tonight
on ABC.
So that rash or spot you said I should keep an eye on, it's definitely getting worse.
Okay, let's take a look.
ew.
There's definitely some swelling. Is it warm to the touch?
Yeah, it's pretty warm.
Okay, well let's try a prescription ointment. Is that a Justin Bieber tattoo?
Okay, gotta go bye.
Stormont Vail now offers virtual care, so you can talk to your doctor almost anywhere. Download the MyChart app to get started today.
Welcome back to our coronavirus discussion. Now we only have a final few more minutes with you. So I have Dr. Kevin Dishman from Stormont Vail back here with us. First, Dr. Dishman, how are things looking right now at the hospital? How are you partnering with community hospitals as well?
You know, Nick really said it best. The reward of serving in eastern Kansas and serving our entire region is how well we work together. Throughout the region, there are critical access hospitals, community hospitals, Stormont Vail, St. Francis, all throughout the community that are working together desperately to meet the needs of the people we care for during this pandemic. We're working together with you, the people that we live with every day, the people that we see at the store, the people that we have shared time in school with our children with, the people that we live with every day. It's that cooperation and that working together that's really built the strength of our response to this pandemic, and it's that strength and caring, just as Nick said, the caring for each other, the grace, that's what's going to carry us through during this period of time as we all work together to meet our needs during this challenge.
Now, how is the hospital's relationship with some of our more rural hospitals and smaller community ones in the area?
You know, over the last several decades, we've enjoyed a stronger relationship with the hospitals that we serve throughout the area. From Hiawatha, Seneca, Sabetha, Council Grove, Coffee County, Onega, Holton, throughout the entire area, we have worked for a very long time with them, caring for people on a day in and day out basis. That has served us well through this pandemic as we think about all the response that the physicians, staff, nurses, allied health personnel throughout the region and all of those hospitals, from Emporia to the Irwin Army community, and everything that they've done to care for people. We've all enhanced our care. We've learned more about the coronavirus, and we've been able to work together aggressively to ensure that people that can safely stay close to home, that can get their care where they live, do so, therefore allowing sicker patients to be sent to Topeka. We'll continue to work together aggressively, and we'll continue to fight this virus together side by side as we've done for many, many years.
Now, the Centers for Disease Control urged people not to travel for Thanksgiving, but obviously that's hard to do for some people as they made some tough decisions. Can you tell us if you know, does Thanksgiving travel have any impact so far? Are you guys seeing more cases in the hospital already after this holiday weekend?
Well, Kelly, not yet. But in preparation for what we feel may be an increase in the number of coronavirus cases, we continue to work every day to create more space, more availability, and more access to health care, not only for Shawnee County, but for our entire region. Our commitment is to continue to work together to ensure that everyone in our region has access to care. We won't know for another 10 to 14 days what effect the Thanksgiving holiday has had on transmission of the virus. It continues to be important that we wear our masks, socially distance, and avoid large groups. That continues to be the message, Kelly, and right now, until we get the vaccination, that's the strongest thing we can do to care about and protect each other.
Yeah, it's definitely important to remember. Now, we have a specific viewer question for you from George Bales. He says he was diagnosed twice with coronavirus, but not specifically COVID-19. And he wants to know if he's being counted as part of our COVID-19 numbers. Can you help our viewers understand the difference and if we're only concerned about COVID-19 or is it any form of coronavirus?
So the COVID-19 virus is a specific form of the coronavirus. There are other coronaviruses and you can test positive for those. Those are not the COVID-19 virus. The COVID-19 virus is our large concern during this pandemic.
Now, Kara Throssell also has a question for us. How long after testing positive can a person continue to spread the virus? It's an important question for people who may have contracted it.
At this time, people diminish in their shedding of the virus over time. What we know is it appears that after about 10 days, that decreases to the point where, provided that people use the appropriate personal protective equipment, maintain their social distancing, that the risk to others after that period of time is diminished.
So on that same note, can you carry and spread the virus even after you've recovered?
For a period of time, you can carry and spread the virus. That's why it's important to maintain the quarantine time that's recommended by our local health department.
Now we have someone who wants a little bit of a clarification on some of the symptoms. Brandon Burton asks, when they tell us that one of the symptoms is shortness of breath, what does that mean? Is it like a severe congestion in the lungs, like whooping cough, or something worse?
Significant shortness of breath varies by the individual. One of the things you can think about is if you were to walk briskly up a flight of stairs, when you reach the top of that stairs, you would be short of breath. Think about that sensation without ever having done any exertion. I think that's the simplest way that I can put it in terms of determining what shortness of breath is. It's a more labored breathing than what someone usually experiences.
Thank you for clarifying that. Now, with such a high number of patients coming into your hospital, are you sending some people to recover at home? At some point, do you have to decide which patient needs the most care?
Every day, as a physician, we make decisions in cooperation with our patients and their families about what the best plan of care is. As we think about those plans of care, it's individual to each patient. We've learned more about this virus, and that education has allowed us to enhance the services that we provide in the outpatient world. This enables people who would normally have been in the hospital to be safely cared for at home by their primary care provider who knows them well. We're utilizing this information to encourage people to seek care early and to seek care from your primary care provider, respiratory clinic, and to use the call before you go hotline. By doing these things, we're able to ensure that we reserve the resources at the hospital for those people who are sick enough to require them, and it allows us to safely care for people at their home, which is where they want to be.
Now, have you noticed any residual impacts of the pandemic at all? For example, suicides going up?
You know, this is a difficult time for everyone. And I think it's important that we remember that we are all in this together. And again, as Nick said, it's important that we offer grace. We have seen increasing behavioral difficulties and behavioral stress, depression during this time. And it's important that we are checking on each other, ensuring each other are coping well, doing well, and continue our commitment to each other during this pandemic.
Well, thank you so much for joining us for the coronavirus special. If you still have a question or something came to mind while you were watching, keep sending them our way, and have a great night.
Frontliners, essential employees, heroes. We've been called many things during this pandemic, but the truth is, we aren't your first line of defense. That title belongs to you, your neighbors, and your community. By wearing a mask, washing your hands, and social distancing, you can keep us safe. Care for others, so we can care for you. Stormont Vail Health, empowering you together.
COVID-19. Will I get it? Will I survive? COVID is scary, but there's one place you should always feel safe. At Stormont Vail Health, our hospital and clinics are taking every precaution to make sure you can still receive your routine and elective health care quickly and safely. Our emergency department with a level 2 trauma center is still the best place for emergent care. COVID-19 is scary, but receiving your health care shouldn't be.